All right, today we're tackling something called dysthymia, which you might also know as persistent depressive disorder. And we're going to look at it from a couple of really different angles, what modern science has to say and what ancient wisdom has been teaching for centuries.
You know, if that question hits home for you, then you already have a sense of what dysthymia feels like. It's not that sudden, heavy crash of major depression. Think of it more like a constant, low-level static in the background. It just slowly, quietly drains the color and vibrancy out of everything. And it can go on for years.
So here's our game plan. First, we'll nail down what dysthymia actually is and what the symptoms are. Then we'll open up two different toolkits for managing it, the modern one and the ancient one. And finally, we'll pull it all together to see what an integrated path forward looks like.
Okay, so let's get right into it. What exactly is this emotional static? What is this thing that so many people feel, but often really struggle to put a name to?
Okay, the key word you really need to latch onto here is persistent. For a diagnosis, we're talking about a depressed mood on most days for at least 2 whole years. So it's not so much about how deep the sadness is at any given moment, but the fact that it just hangs on. That constant, endearing nature is what really defines it.
And you know, this is hardly a new concept. The ancient Greeks had a word for a similar state, melancholia. Fast forward to the 19th century, and you see doctors starting to identify these chronic depressive dispositions. But it wasn't until pretty recently, in 2013, that it was officially named persistent depressive disorder, finally giving it a clear spot in modern medicine.
All right, so we've talked about that grayscale feeling, but what's the day-to-day impacts really like? What does dysthymia actually look and feel like for someone living with it?
Well, the core symptoms really paint a picture of what this is like. You've got low self-esteem, this constant feeling of being tired or having no energy, and just a sense of hopelessness. And it often shows up physically too. Things like your sleep schedule being all over the place, changes in appetite, and just finding it really hard to experience any kind of pleasure or joy.
And this is absolutely crucial to understand, because these symptoms are so chronic, because they creep in so slowly over time, a lot of people start to think, well, this is just me. This is my personality. They see it as part of who they are, not as an actual illness. And that mindset, right there, can be one of the biggest hurdles to ever getting help.
So what can be done about it? Let's start by opening up the modern toolkit. These are the evidence-based approaches from medicine and psychology that are really designed to help turn up the color and volume in that grayscale world.
Modern science really comes at this from two main directions. On the one hand, you have the medical approach. It tends to see this as an issue with brain chemistry, neurochemical dysregulation, and uses things like antidepressants to help get those chemicals back in balance. Then you have modern psychology, which zooms in on our thought patterns, our habits, and our relationships. It uses therapies like CBT, cognitive behavioral therapy, to help people identify and change the negative thinking cycles that keep that low mood stuck in place.
And this right here is exactly why getting treatment is so important. If you leave dysthymia unmanaged, it can lead to something called double depression. And that's when a full-blown major depressive episode happens on top of that chronic low mood. It creates a really serious, even dangerous crisis.
Okay, so that's the modern view. But now let's shift gears and look beyond that. Let's explore some ancient wellness systems that have been grappling with this same problem for literally centuries, but from a totally different perspective. Their focus is all about restoring that inner balance to bring the color back into the picture.
So these ancient toolkits, they look at this through a completely different lens. Take Ayurveda, for instance. It might see this chronic low mood as an imbalance of something called kapha tamas. You can think of that as a kind of deep-seated stagnation, both physically and mentally. So the treatments are all about restoring that flow with diet, herbs, and lifestyle changes. Then you have yoga, which frames it as a blockage of prana, or our vital life force energy. The idea there is to use physical postures, specific breathing exercises, and meditation to get that energy moving freely again.
Okay, so we've got these two really powerful toolkits, right? One is focused on the brain and the mind, the other on the body and its overall balance. So what if the most effective path isn't about choosing one over the other, but about integrating the best of both?
And this table really lays it all out beautifully. You can see how these systems fit together. Modern medicine, it's fantastic for directly managing symptoms. Psychology is incredibly powerful for changing those deep-seated thought patterns. And then you have ancient practices like Ayurveda and yoga, which give us holistic tools to build real long-term resilience. As you can see, each one brings something unique to the table, and each has its own strengths and, its limitations too.
So what's the big takeaway here? It's that an either-or approach probably isn't the most effective. A both-and strategy, where you combine the targeted treatments from modern science with the self-empowering practices from ancient wisdom, well, that can create a much more sustainable and personalized path to managing dysthymia. And of course, it is absolutely essential to know when it's time to get professional help. If you've had a low mood that's just been dragging on for months, if it's starting to interfere with your work, your social life, your relationships, or if the symptoms are getting worse, that's your cue. It's time to talk to a doctor. Remember, these complementary therapies are meant to be part of a professionally guided plan, not a replacement for one.
So, we'll leave you with this question to think about. What if the most effective kind of care, the kind that truly helps people heal, doesn't force a choice between the latest science and ancient wisdom, but instead finds the art in combining them?